regarding urinary incontinence. So the old data, and this was using the traditional approach, was that 85% of men who had the old traditional version, which means the incision below the belly button down to the bone, 85% would be using one or less pads per day at the 1 year mark. Using robotic surgery, and I've certainly seen this in my patients, it's really closer now to the 3 or 4 month mark. So after we remove the prostate, we have to reconstruct the urinary system because the prostate sits right below the bladder and it's connected to the urethra, which is the tube that you urinate out of. So when we remove the prostate, we have to then reconnect the bladder to the urethra. So the initial time after the surgery, there will be some urinary leakage, and that's not uncommon. And there's nothing there's no surgeon in this world who can make that stop from happening. But with a robotic surgery, because we have such more precise dissection and such a better visualization of the prostate, those numbers for incontinence have come way down to really around 3 to 4 months is when people would be completely dry. Or maybe just using a protective pad, and that's certainly what I've been seeing with my patients over the last 4 or 5 years. Kegel exercises, these are important in rehabilitation. Kegel exercises, I always tell people to imagine that you're standing and you're urinating, and maybe your niece walks in the door and you want to stop your urinary flow right then, and you squeeze those muscles between your leg right in the middle of the urinary flow. That's the muscle that we teach people how to use in order to help regain continence. Okay, we teach women this after childbirth because women will also leak urine, and that's one of the ways by strengthening those pelvic floor muscles that we're able to get you dry again. And that's a very important part. And if you were to be diagnosed, I would teach you how to do that if you were to undergo the surgery. Erectile dysfunction. Several ways that I can predict how your erections are going to be after surgery, and that's number one, based off of your preoperative erectile function. So we do questionnaires and we talk about erections and your sex life prior to the surgery, and certainly if you come into surgery with bad erections, you're not going to come out with better erections, and that's just kind of the nature of it. The second thing is age. If you're older, closer to 70 or 80, then your erections are certainly not going to be as good, and that's based off of the cardiovascular events that happen throughout your life. Even if you don't have heart disease, the blood pressure and such, and the way the vessels are made, they don't respond as well as you age. And then whether we do nerve sparing or non-nerve sparing, and this is one of the advantages of using the robotic system is that we're actually able to dissect the nerves off the prostate, which go to the penis, and that the ability to spare those nerves is what's really improved, number one, erectile dysfunction, and number two, urinary incontinence, because those nerves are also important in being able to control your urination. Penile rehabilitation, so this is, after if you have the prostate cancer surgery or if you have radiation therapy, this is a kind of a planned program to help you maintain those erections. It really holds true that if you don't use it, you lose it when it comes to erectile function. We have lots of ways to do it, and there's good protocols that we start patients on to be able to get that blood back in there and to get those erections back to a usable state. The good thing is that erections will continue to improve up to 2 years after surgery, and that's all based off of nerve regeneration. So even if the nerves are damaged, then oftentimes they'll grow back and they'll recover, and so erectile function will improve out to 2 years of surgery. Reassurance and communication are really the key when it comes to erectile function.